Hello guys, good afternoon everyone. Today we will see some of the basic questions for upcoming staff nurse recruitment examinations in the Telangana. So the first question is gallbladder located at the. So the options are upper right quadrant, right side of the liver, on the left side of the liver, below of the liver. So the gallbladder is located at the below of the liver. So in the picture you can see this is the liver, and the gallbladder, the green color structure you can see, it is located at the lower surface of the liver. So the right answer is below the liver. The next one is all of the following enzymes secreted by the gastrointestinal tract except one. So the options are ptyalin, pepsinogen, gastric lipase, angiotensin. The right one is angiotensin. So angiotensin is the hormone secreted by the kidney, but these three hormones are secreted by the in the gastrointestinal tract. The next one is cardiac sphincter is situated at. The options are heart, cardiac, end of the esophagus, end of the stomach. The right one is it is located at the end of the esophagus. So if it is the esophagus, this is the stomach, so the cardiac sphincter will be located here. The next one is length of the esophagus. So what is the length of esophagus? Options are 25 centimeters, 55 centimeters, 10 centimeters, 15 centimeters. The right one is 25 centimeters. So the normal length of the esophagus is 25 centimeters. The next one is the peristaltic movement of the esophagus. Options are it is a voluntary action. Option B, it is a involuntary action. Option C, either A or B. Option D is the none of the above. The right one is it is a involuntary action. So in the esophagus we can observe the peristaltic movement which are not controlled by the person. So it is involuntary action, involuntary peristaltic movement. The next one is capacity of newborn stomach. Options are 20 ml, 30 ml, 15 ml, 100 ml. The right one is 30 ml. So 30 ml is a normal capacity of the newborn baby stomach. The next one is Meckel's diverticulum arises from. So where we in the gastrointestinal tract, Meckel's diverticulum develops from which part of the intestine? Options are stomach, cecum, colon, or ileum. The right one is ileum. So in the picture you can see the ileum part of the intestine. So here we can see the Meckel's diverticulum. So this condition mainly arises from by birth itself. So it is a congenital malformation. The next one is layers of GIT. GIT is nothing but gastrointestinal tract. So the options are first one is the mucosa, submucosa, muscularis, serosa. Muscularis, mucosa, submucosa, serosa. Submucosa, serosa, muscularis and mucosa. Last one is muscularis, mucosa, serosa and submucosa. So the right one is option A. So from inside to outside, the first layer is the mucosa, and the second one is the submucosa, third is the muscularis, and the outermost layer is the serosa. So the right option is option A. The next one is length of the large intestine. Options are 1.5 meters, 3 meters, 6 meters, 4.5 meters. The right one is 1.5 meters. So the normal length of the large intestine is 1.5 centimeters. Sorry, 1.5 meters. The next one is portal vein supplies to. So the portal circulation, where we can see options are spleen, liver, pancreas, colon. The right one is liver. So in the liver system we can see the portal vein, and it supplies the blood supply for the liver, that is portal vein. The next one is iron absorption takes place in. So in the gastrointestinal tract, where the most of the iron is absorbed. Options are duodenum, ileum, colon, jejunum. The right one is a duodenum. So duodenum is a perfect part for the absorption of iron, and it is a first part of the small intestine. The next one is artery supply to the stomach. So which artery will supply the oxygenated blood to the stomach? Options are carotid artery, gastric artery, celiac artery, cephalic artery. The right one is celiac artery. So celiac artery will give the supply for the blood to the stomach. The next one is, what is the pH of gastric juice? So the gastric juice is secreted in the stomach. So what is the normal pH of the gastric juice? Options are 0.2 to 1.5. Option B 1.5 to 3.5. Option C 3.5 to 5.5. Option D 5.5 to 6.5. The right one is option B, that is 1.5 to 3.5. So the gastric juice is acidic in nature. The next one is, which is the richest source of energy? So among these four options, which will give a rich source of energy? So in the emergency conditions, which will give the energy? Options are cereals, rice, orange juice, milk. The right one is orange juice. So orange juice will give the energy, and which will give the rich source of energy we can see in the orange juice. Why? Because it consists of sugar. So the next one is, in which quadrant the appendix will be located? Options are right lower quadrant, right upper quadrant, left lower quadrant, right lower quadrant. So the right one is option A. So it is just a small mistake. So the appendix will be located at the right lower quadrant. So here you can see the right iliac region. So here we can find the appendix. So in our total abdomen, we have the total 9 quadrants. First one is the right hypochondriac, second is the epigastric, third is the left hypochondriac, fourth one is the right lumbar umbilical region, left lumbar, right iliac, hypogastric, left iliac. So totally 9 quadrants are present in the human abdomen. So the next one is sigmoidoscopy done in which position? So the person is in which position, and this person is ready for the diagnosis by the sigmoidoscopy. So the options are lithotomy position, jackknife position, phallus position, knee chest position. So what is the position name? That is option D. So this knee chest position is the best position for the sigmoidoscopy examination. The next one is inflammation of tongue. So what is the name of when the infection attack to the tongue, that is inflammation of tongue. Options are stomatitis, gingivitis, glossitis, halitosis. The right one is glossitis. So glossitis is nothing but inflammation of the tongue. The next one is identify the condition. So in the picture you can see the stomach. So this is not a normal stomach structure. So here we have the diaphragm and some protrusion, and it is like a bulging part of the some part of esophagus and stomach. So here we can see. So what is the name of this condition? Options are esophageal fistula, hiatal hernia, pyloric stenosis, stomach protrusion. So what is the condition of this picture? That is hiatal hernia. So hiatal hernia, we can see it is starting part of the stomach and ending part of the esophagus. So the next condition is, so here in the picture you can see, okay, so this is some abnormal condition. So what is the condition of this abnormal condition? Options are esophageal fistula, hiatal hernia, pyloric stenosis, stomach protrusion. So the same options for this question also. So the right one is pyloric stenosis. So pyloric stenosis is nothing but pyloric sphincter is stenosis. It means the sphincter is coming together and it obstructs the entry of food particles which are present in the stomach. It will prevent the entry into the duodenum. So this condition is known as pyloric stenosis. So pyloric antrum is present at the end of the stomach. So the last question is identify the condition. So what is the condition here in the picture? Options are appendicitis, hiatal hernia, pyloric stenosis, intussusception. The right one is intussusception. Intussusception. The right one is intussusception, means the intestine, some part of the intestine is enter into the other part of the intestine. So it is commonly occurred in the small intestine, either in small intestine or large intestine. So this condition is called intussusception. The next one is what is parasynthesis? So what is the name of and what is the meaning of parasynthesis? Options are collection of fluid in the thorax. Option B, collection of fluid from the peritoneum. Option C, collection of fluid in the heart. None of the above. The right one is option B, collection of fluid from the peritoneum. So when the peritoneum has infected with some bacteria or virus, some of the fluids will be accumulated in the peritoneal cavity. So in this condition, parasynthesis is a procedure, that is collection of fluid from the peritoneum. And the next one is positive morphe sign seen in. So in which condition we can see positive morphe sign? Options are cholecystitis, pancreatitis, gastritis, obstruction in the colon. So the right one is cholecystitis. So cholecystitis is nothing but inflammation of the gallbladder. So the positive morphe sign we can see when the examiner is pressing the right upper quadrant, and at the same time the examiner asks to the patient to take a deep breath. So during that time the patient will have the pain over there. So that is positive morphe sign. And the next one is most common site for ulcerative colitis. Options are duodenum, descending colon, ascending colon, rectum. So the right one is rectum. So rectum is the most common site for occurring of ulcerative colitis. So ulcerative colitis is nothing but the ulcer formation in the rectum and it is infected. So the next one is a cooling sign is seen in. So what is the cooling sign? So in which condition we can see? Options are hemorrhage in abdomen, hemorrhagic pancreatitis, cirrhosis of the liver, diverticulitis. The right one is hemorrhagic pancreatitis. So in the case of hemorrhagic pancreatitis, we can see the cooling sign. So the cooling sign is nothing but a bluish discoloration of the bluish discoloration of the abdomen that is near to the pancreas, that is called cooling sign. The last question is sphincter of OD. Okay, sphincter of OD is located at. So where we can see the sphincter of OD? ODDI, that is OD. Options are liver, pancreas, duodenum and stomach. The right one is option C, duodenum. So in the picture you can see this is the duodenum. Okay, this is a small intestine and this is the pancreas. Okay, here we can see the sphincter of OD. The the liver, it is from the gallbladder and it is from the gallbladder. We can see the green color structure and this is the pancreas, pancreatic duct and gallbladder duct and a pancreatic duct which are togetherly enter into the small intestine, that is duodenum. So this is called sphincter of OD. So this is my end of class guys. I hope you all understand.